Hi, Dr. Pelto here. We are doing some ingrown toenails. You can say I marked them. It's the second toe. There's both edges, big toe, both edges, and the same thing on the other foot. I caringly call these toes Fred Flintstone toes, and because they're kind of wide. Now, don't do this at home, and because I had some patients, or people on YouTube, they asked whether or not they were numb, and yes. So I've put in a lot of anesthetic, and then I check them, and then I put more anesthetic, and then I check them, and once they're totally numb, then I can do the procedure. So once again, you probably shouldn't do this at home. Okay, we're going to start with this foot. We're going to do, this patient has a chronic ingrown toenails for a long time. We're going to do that matrixectomy procedure, so we just kind of free it up on the edges.
See, I can feel that.
Okay.
It doesn't kill, but it...
Yep, you're going to have a little pressure. So pressure is normal. Pain. Now the challenge with doing these second toes, as I mentioned, is that it narrows it a little bit, and so sometimes there's a little bit of toenail in there, and there's two risks: recurrence, little infection, or loosening of the nail with the medicine we put in here. And I do use sodium hydroxide, not phenol. Doing okay?
Yeah.
Okay, once I do all the edges, then I get my little English anvil and I just cut a little snip.
Ow.
Okay, and I take a blade here. This just makes a nice straight cut. And it goes, you want to go underneath the skin so you don't cut the skin. Tell me how this one feels here.
I can feel that a little bit. It doesn't hurt, but yeah, that
Hurt? Pressure.
hurts.
Okay, just have to do this one here. Okay, be quick. I take a hemostat. There's a like callus that's stuck in the edge. Some people ask me why I throw everything on the ground, and I don't. There's a little tray underneath me where I throw things. If I threw it on the ground, all my staff here would be upset at me. And I usually do throw stuff on the ground. They just are nice and they don't tell me. One's here recording for me until I get my new tripod. And I'm trying to compete with the Toe. I'm getting the same tripod that Tobro has to try to compete with him.
Yeah, that hurts. That hurts.
I'm done. There, hold on, that one. So sometimes it hurts, and the reason is there's two nerves on top, one on the top, two on the top and two on the bottom. And when you do the injections, sometimes one of them I tell you, if you haven't had enough ingrown toenails after this,
I better not get any more.
So this is all like callus tissue. It's all that callus stuff that's in the edge too. And you just want to feel it under the base, make sure you got all the nail from it. And once you get all the nail, as long as you can get the acid in there. And so what I do is I put the sodium hydroxide in the base and I try to get all the cells. Sometimes they hide when I'm twisting it in there, and there can be a little regrowth of a spicule that happens occasionally. Is that okay?
Hurts. Yeah, that hurts.
So if you're still watching up to now on YouTube, you must really like this, because this is getting tiring because there's so many nails. This is, I've done more than this, but this is 2, 4, 6, 8 edges of nails. It's a lot of nails. So that means I need 8 little Q-tips. These are micro Q-tips. These aren't any normal Q-tip. And so these little Q-tips, they're very thin, and they kind of go right into the edge. This is my special medication. So the nice thing about sodium hydroxide, it doesn't make as much smell. As the phenol. And you kind of put them all in. And you try to do it the same way. Kind of put them in, and that's about 30 seconds. So that's about 30 seconds for that one. And then after you do that one, there's about 30 seconds for this one.
I can feel that one on the right side of my big toe.
Yeah, I'm almost got it out. So what she's feeling is the acid stuff that's in there, or the sodium hydroxide, and then this is vinegar, so it smells kind of like tossed salad. Can you smell that? Yeah.
Mm-hmm.
Makes you want to get some olive oil and
Yeah. That's what I'm thinking right now.
Right,
Yeah.
salad. Yeah, that's what you're hungry for right now. Okay. So you want to make sure you take off these little things around the toes. Those are called tourniquets. That's why the toe isn't bleeding. Some people ask me that question too. Why doesn't the toe bleed? It's because I got this little thing around there. Okay. Then we kind of get things ready. So most of my patients do the Amerigel kits. Okay. So this is the hard part. Look at all that tape we got. That's going to be a lot of work. So you kind of want to get to the tape before it starts bleeding like it is like that. Okay, grab the tape. Oh boy, that's a big piece. Okay.
You need a small one?
No, I think let's do the big ones first here. Now with so many toes, the hard part is taping them, as you can see. And you wanna, so she's a good bleeder.
Mm.
Yeah, let's do the next one, a smaller one here. Yeah.
You're welcome.
And so we want to keep a lot of pressure on here to stop the bleeding. And we have little toe socks. Some people comment that these are so cute.
Can I see?
Yeah, see the little
Oh, they're very cute.
toe sock. So I would recommend kind of going home and taking it easy, otherwise these are going to bleed.
Okay.
I'm never going to film 8 of these again.
I'm like just amazed at how great I am at multitasking.
I'm just going to do one from now, because if you learn how to do one, you got 8. Okay?
Yeah.
So it's the same thing. I guess YouTube likes longer movies, so
Yeah.
they say that they have an optimal viewing amount of time.
Now, why would a person want to go onto YouTube and watch this? What would be the reason?
You know, I don't know. You can post a comment on the bottom here and tell me why. But I think people like getting grossed out. I think
Okay.
they like gross
So,
things.
you know,
Why do they watch Dr. Pimple Popper?
that's what I was
Right?
just going to say.
They,
Oh,
they
I
do.
watch stuff like this all the time.
See?
Do you really?
Why? Now, so why? So you'd be a perfect candidate.
I just like gross stuff.
Yeah,
Okay.
so people like gross stuff.
I mean,
And it's
people use YouTube
interesting.
to learn how to do something. Well, you're not going to learn how to do this.
Well, if you do, you probably shouldn't try it yourself.
kind of like the medical school avenue, first.
Little working thing. So I always do something special on my patients, especially to make sure she knows which video she's watching. So this is a smiley face.
Okay.
And this here is going to try to be a dog. So there's the head, there's the ears, there's the eyes, there's the tongue, there's the feet. Yeah, I know. I wanted to be an art. Actually, I wanted to be a magician. I'm serious. So
That is not something a person wants to
no,
do.
I want. So being a doctor is my backup plan.
Oh, okay.
I wanted to be. I was a magician from 7 to 17 years. We're gonna make a video on some of my.
Seriously?
Seriously.
Wow, good for you.
Yeah, I did won all these talent contests in New Ulm, Minnesota. Yep, that's where I'm from.
So you could go on that America's Best.
I
or
got
whatever.
talent. They could have
Yeah, there you
Got talent. We could do that. So there's your feet. Thanks.